Can trauma or injury trigger frontotemporal dementia? Have you ever wondered if a bump on the head could lead to something as serious as frontotemporal dementia? This is an important question, especially as we learn more about how brain injuries affect our health. Frontotemporal dementia, or FTD, is a group of disorders that cause progressive damage to the frontal and temporal lobes of the brain. This damage can lead to changes in behavior, personality, and language skills. When we talk about trauma or injury, we often think of traumatic brain injury, which is a well-known risk factor for certain types of dementia. Research shows that traumatic brain injury can kickstart processes that lead to neurodegeneration. This can result in cognitive issues like memory loss and difficulties with thinking and decision-making. Some studies estimate that between 5% and 15% of dementia cases may be linked to previous brain injuries. However, the connection between trauma and frontotemporal dementia specifically is not as clear-cut. While traumatic brain injury can lead to long-term cognitive decline, frontotemporal dementia has its own unique causes. FTD often involves specific genetic mutations or abnormal protein accumulations that differ from what we see in other types of dementia, like Alzheimer's disease. Current scientific understanding does not firmly establish a direct link between trauma or injury and the onset of frontotemporal dementia. That said, it is possible that brain injuries could worsen neurodegenerative processes in individuals who are already vulnerable. This means that while trauma might not directly cause FTD, it could potentially influence the progression of symptoms in those who are predisposed to the disease. It's important to remember that research in this area is ongoing. The relationship between brain injuries and neurodegenerative diseases like frontotemporal dementia is complex and still being explored. If you or someone you know has concerns about dementia risk after experiencing a brain injury, it is essential to seek personalized medical advice from healthcare professionals. They can provide guidance tailored to individual health needs. In summary, while traumatic brain injury is a recognized risk factor for some types of dementia, the evidence linking it directly to frontotemporal dementia is limited. FTD typically arises from distinct mechanisms that are not primarily related to trauma. Understanding these differences is crucial as we continue to learn about brain health and dementia.